Hi, my name is Claire Ellerbrock. I am a nurse practitioner, and today I'm going to talk about how to supercharge your way to success as an NP. So, the most difficult part of being a brand new nurse practitioner is that there is so much that you feel like you don't know. And as a result, you might feel unworthy, unsure, anxious, lack confidence in your ability to step into this role as a nurse practitioner. Now, these feelings are valid because you are brand new and there is so much you don't know. And school only teaches so much because there's so much that needs to be covered. And I certainly felt this way too when I was a new nurse practitioner. I didn't feel ready for practical things like the mechanics of writing a prescription out or how to confidently handle prescribing a new medication who is taking 10 other medications also without causing a drug interaction. I didn't feel ready to involuntarily admit a patient into a behavioral health unit if needed due to active suicidal thoughts and plan. I didn't know how to maintain endurance of seeing patient after patient in short intervals all day, every day. So these things were just not taught in school, at least not sufficiently in a way that I felt confident transitioning into practice. It's an understatement to say I felt unsure in my first few weeks of my first job as a nurse practitioner. I stumbled out of my quagmire of unsureness a few weeks into my first job, luckily. I was working in a community mental health setting, helping underserved patients with very complex needs, and I realized I needed some extra assistance, really mentorship. And I decided to reach out to a psychiatrist I had shadowed during one of my clinic rotations in my MSM program. And I remember this physician being very knowledgeable and open to teaching me during my clinical rotation. I learned so much from him during this time, and I was able to ask him any questions that I had. I remember that he was a wealth of information and a wonderful resource. And so when I had entered practice and I was having a hard time, I remembered the psychiatrist and I reached out to him and asked if he would be open to meeting with me regularly for ongoing consultation or supervision while I was navigating my way during my first job as a nurse practitioner. Luckily, he graciously accepted, and I suddenly felt a lot more supported in my role. No longer stumbling alone in my job, I had some reinforcement from a knowledgeable, seasoned provider I could consult with on weekends to discuss my complex patient cases and prescribing questions I had. I noticed my confidence started to increase as the next few weeks and months passed. I learned more than I had in quite some time, and I felt as though I had supercharged my way to success through doing private supervision with an experienced provider. Working with a seasoned provider, whether physician or nurse practitioner, is the single best way to grow your knowledge as a new graduate. You shouldn't necessarily look to your employer to receive mentorship. You should proactively seek it out on your own. Private supervision or consultation on a regular basis is the key to receiving the support you need early on in your career as a nurse practitioner. Now, I was fortunate enough to find a physician, a psychiatrist, who was willing to provide me regular consultation and feedback on my patients. This was incredibly valuable and significantly increased my confidence and competence and support in my first year of practice. This mentorship and eventually friendship provided me insight not only on medication management, but provided reassurance in my role and normalized a lot of the challenges I experienced as a provider. Consultation isn't for nurse practitioners only. I think it's a great way for new physicians and physician assistants to receive support in their role as well, starting out. And if you're lucky enough, you might find a mentor and ultimately a good friend along the way too. So I hope this little tip provides some insight for any new nurse practitioners or other new providers who are looking for more guidance in their role. If you want to learn more about my business, my course, and free resources, you can check out my website, npfornps.com. And I will see you next time.